These things are pretty unpredictable at this point.
An unpredictable recovery for Tua Tagovailoa from what is now a fairly common procedure. Tonight, inside the tightrope operation. While the surgery may be more practical, one doctor explains to ABC 3340's Andrew Donnelly how it works and the timetable he gives his own patients after this.
It's a cringeworthy play for Alabama fans. Tua Tagovailoa suffered a second ankle injury, this time on the other leg. It's something Dr. John Young has seen throughout his years as an orthopedic surgeon.
That there's been disruption of this ligament, and that requires fixation.
That fixation has changed over the years, going from screws to what they call a tightrope system.
So you can see here's an example right here. We've drilled a tunnel through the fibula, through the tibia. This little oblong piece of metal comes out vertical, then gets flipped, and so it can't get back through, and then the suture goes through this little button, and we pull it real tight.
Dr. Young says it's rare to see this type of injury without seeing some sort of fracture in the bone. And if there's been no fracture, in Tua's case, recovery time will likely be shorter. But just how long are we talking? Here's Dr. Young with the timetable for most average cases of high ankle sprains.
I think you would be real optimistic at a month and a half, because that's a good bit of time. To me, you know, in the 2 to 3 week, that's harder. That's harder because you know it's not totally healed at that point.
However, for a healthy athlete that's been through this before, it could be a shorter recovery. Andrew Donnelly, ABC 3340 News.
Dr. Young goes on to tell us this is an injury that is typically associated with more extreme movements like sports. He says he has treated patients of all ages for this, and they can come back 100% of the time if arrested properly.